one of the big challenges for all of science and medical science has been to translate basic science to the bedside. Things that we're developing in the laboratories to understand the disease and translate that into things that actually make a difference for patients. That's always been the biggest challenge. Now, we've seen that in recent years, and what we need from the next generation is to be able to do that in an increasing level at multi-areas of science, to bring those new discoveries to the bedside and help patients.
The MS Society and the endMS network is bringing a lot of focus and attention to research that needs to be done relating to MS. One of the great things that happened this week is we got to hear people living with the disease talk about what they've experienced and how it affects and impacts their lives. So we know kind of what research needs to be done to help these people, what will help make their lives easier in the future.
A lot of the students work in labs with slides, brain slices, and looking at proteins and immune responses and so on. And so they don't really get to see people with MS and how the disease impacts them emotionally, physically, cognitively, psychologically. And so I think this week was a really great overview of the clinical aspects of MS and how it impacts people in their lives. I particularly think meeting with the patients today was a great way to sort of wrap things up, because then they were able to hear about what all of us as speakers were saying that we see with working with people with MS, and then they got to hear it from the people who are actually affected by it.
Patients with MS do need, they need attention and care at all levels. They need someone who can actually answer the questions that they may have. We don't have answers to all the questions, but they need someone to be there and follow them through that walk that they have to go that's so difficult. So there is a need for a clinician who's involved in that. But we also need people who can answer questions and develop new therapies to help the patients further.
I think in the next 10 years, Canadian researchers are going to have made significant advances in terms of understanding the impact of MS on people's lives, in terms of developing new innovative approaches to therapies.